As helminths have three classes of parasites: nematodes, trematodes, and cestodes. Nematodes being the long round worms. Trematodes, also called flukes, they have got leaf-like structure. And the third one, cestodes, they are long ribbon-like parasites, also called tapeworms. And among the tapeworms, those pathogenic to human beings, they include Tinea saginata, also called beef tapeworm, Tinea solium, the pork tapeworm, Lifecycle, the fish tapeworm, Echinocarpus granulosus, which is the hydrated worm, and the last one, Hymenolapis nana, also called the dwarf tapeworm. We'll take them one by one, starting from Tinea saginata, and along with this, the Tinea solium also, because many of the things they are very similar uh, between these two parasites. About Tinea saginata, also called beef tapeworm, it is a zoonotic tapeworm. The adult worm is 4 to 10 meters in length, that is long enough, and even it can be larger, more than 10 meters in length. Body is flattened dorsoventrally and is segmented. The parasite has got three portions: the scolex, that is head portion, then the neck portion, which joins the head with the body. Body is called strobila. The scolex or head portion has four suckers, by virtue of which the parasite attaches itself to the intestinal wall, but it has got no hooks. Strobila, that is the main body of the parasite, is basically a chain of numerous body segments, and each segment is proglotid. And the neck is the shortest part of the body which joins head with the body. About Tinea saginata, the head portion of Tinea saginata has got four suckers on it, by virtue of which it attaches itself to the intestinal wall. On the most anterior portion of the head, the rostrum, in this picture, the hooks have been shown, but in Tinea saginata and Tinea solium, no hooks are present. There is the small neck portion which joins the head, body, or the strobila. And about the strobila, the segments they are formed, they are newly produced from here, and they go on maturing and maturing as time goes on, and then at the end they get mature and they get gravid, and they get separate from the body, and they migrate towards the anus, and they are passed out in the feces. Well, this parasite is a hermaphrodite. Each body segment, that is a proglotid, uh, has got complete sets of both male and female reproductive organs. The habitat of this parasite is that the parasite lives in the intestinal canal of human beings. The humans are the definitive host, and they harbor adult worms, the length being 4 to 8 meters in length, usually it is less than 4 meters. The cattle, like buffaloes and cows, are the intermediate host which harbor the form a baby parasite, cystis cerci, encysted in their muscles. About the life cycle of Tinea saginata and Tinea solium also, that the disease tinnitus produced by the infection of this uh, uh, infection with these parasites in human beings, the adult tapeworm of Tinea saginata or solium, they live in the intestinal canal. The humans are the only definitive host. Adult tapeworms, they attach to the whole intestinal wall by their scolex, by virtue of the suckers. The adults produce proglotids which mature, become gravid, detach from the tapeworm, migrate towards the anus, or are passed in the stools. and approximately 6 proglatids are passed in the stools per day. The eggs from the proglatids, eggs which can survive for days to months in the environment that is on vegetation. The cattle, like buffaloes, cows, and pigs, also they become infected by ingesting vegetation contaminated with the eggs or the gravid proglatids. In in animals' intestine, not humans, in animals' intestine, the eggs hatch, producing a form of baby parasites called oncospheres. These oncospheres they invade the intestinal wall and reach circulatory system. That is, they make contact with the circulatory system, uh, and in the while present in the circulation, they reach the striated muscles of these animals, where they are encysted in a covering of connective tissue, and they are called cysticerci. Now, these cysticerci they can survive for several years in the muscles of these animals. The human beings they become infected by ingesting raw or undercooked infected meat. In the human intestine, the cysticerci they come out and they develop into an adult tapeworm over a period of about 2 months. The adult tapeworms they attach to the small intestine by virtue of this suckers present on the scolex, and they reside there for years. The adults produce proglatids which mature, become gravid, detach from the worm, and migrate towards the anus. Tinea saginata may produce up to 100,000 eggs per proglotid. This is of the picture of life cycle of Tinea saginata and the Tinea solium also. About the disease produced by Tinea saginata, it is called teniasis. The patients are usually asymptomatic, but when heavy infection is there, there may be abdominal pain, nausea, constipation, diarrhea, dizziness, chronic indigestion, and with these all symptoms, the result is the weight loss of the patient. The encysted larval stages may cause space-occupying lesions beings and also in domestic animals. That is, in human beings, apart from the symptoms produced due to the presence of the parasite in the intestine, there may also the baby parasites, that is cysticerci, they may be encysted within different organs of the body, like liver, lung, or also. And in this way, they can produce space-occupying lesions there. About the diagnosis of the parasite is diagnosed by stool examination to find characteristic tinea eggs. And characteristic tinea eggs, they look like this. In the center, there is a hexacanth embryo, which is enclosed within a thick protein coat, which is striated. The thick striated protein coat. And these eggs and both species, they are similar in morphology. They are spherical, for the measurement being 40 to 48 microns in diameter. They are surrounded by a thick striated wall, and they contain the hexacanth embryo. Looking at this scolex, gravid proglottids can help identify it as Tinea saginata. Well, when the infestation by this parasite is there, the eosinophil count and the percentage in patient's blood is increased, which is called eosinophilia. And also the IgE levels, there is immunoglobulin E levels are raised in these patients. So eosinophilia and elevated IgE levels are the chief hematological findings. The next parasite to be discussed is Hymenolapis nana. It is also called dwarf tapeworm. It's the most common cestode infecting humans, especially in children. It's an intestinal parasite, but that is, it also lives in the small intestine of human beings. Uh, it is seldom, the measurement seldom exceeds 40 millimeters. Yeah, that is about 4 centimeters in. It is about 1 millimeter wide, and there are three portions of this parasite, that is head, neck, and the body, which is called strobila. About the structure of Hymenolapis nana, the scope portion bears 4 suckers, and on the rostrum, that is the most anterior portion of the head, so the hooks are also present. There are 20 to 30 hooks in this species, by virtue of which it attaches itself to the wall of the intestine. There is scolex portion, the small neck, and then the strobila, in which segments are there, and each segment, when mature, contains a complete set of male and female reproductive organs. About the life cycle of Hymenolapis nana, starting from the intestine of human beings, the parasite lives in the intestine of human beings, produces troglodytes, which go on maturing and then becomes gravid, and they produce, uh, they migrate towards the anus, and they are passed in the stool, or the are produced. Now these eggs, when present in the environment, can reach human beings again in 2 ways. One, that directly it is ingested in contaminated food and water, and in the second pathway, these eggs, they are ingested by the insect, and within the insect it develops, and cysticercoids are developed in this insect, and human beings and the rodents like mice, they can be infected when they ingest cysticercoid infected arthropods. And in this, it reaches in the intestine of the human beings, where they develop into adult worms. Well, the second way on this side, on the right side, is that autoinfection can occur within the intestine, that is within the human intestine. What happens is that the eggs which are produced within the intestine, they can auto-infect the in the way that they penetrate the intestinal villi, and within the intestinal villi, oncospheres uh, oncospheres hatch, cysticercoid develops in villus, and then with development, the mature worms are produced, and they repeat this cycle in the usual way. So, repeating the life cycle once again, it occurs only one host but can also cycle through 2. Eggs immediately infective when passed the stool and cannot survive more than 10 days in the external environment. Eggs ingested by arthropod, intermediate host develop into cysticercoid larvae. The cysticercoid larvae, after ingestion by humans and rodents, develop into adult worms. Eggs which are passed in the feces, tested by human beings in contaminated food or water, oncospheres contained in the eggs are released, and this is a form of auto-infection. The oncospheres, that is hexacanth embryo or hexacanth larvae, they penetrate the intestinal villus and develop into cysticercoid larvae. The rupture, cysticercoids return to the intestinal lumen, attach to the intestinal mucosa, and develop into adults and reside there. The eggs, they Proglottids are produced, they get mature, they get gravid, and eggs are produced and passed in the stool when released from the proglottids. About the disease produced by this parasite, there is Hypnolepis nana. As most of people, they are asymptomatic, but when there is heavy infection, there may be nausea, weakness, loss of appetite, diarrhea, and abdominal pain. The children with heavy infection may have headache, itchy bottom, or have difficulty sleeping, and they can be misdiagnosed as suffering from pinworm infestation. How this parasite can be diagnosed. And the parasite is diagnosed by finding characteristic eggs in the stools. And how do characteristic eggs they are seen? This is a picture of characteristic egg of Hymenelepis nana. That is, it is 30 to 47 microns in diameter. Embryo covered with a thin hyaline outer membrane. That is, in the center, there is hexacanth embryo, and it is covered by an inner thick membrane with bipolar thickenings. This is the inner thick membrane and with bipolar thickenings that bear several filaments. So by finding these characteristic eggs in the stools, the Hymenelepis nana infestation can be diagnosed.